Well, let's stay with that budget and discuss exactly who will be worst affected by, the constraints that are expected to be faced. Russell Rensburg is with the Rural Health Advocacy Project. He joins us now tonight. Russell, you heard the health minister there. He talks about the fact that the vacancies that currently exist unlikely to be filled. That means that the capacity of the healthcare system overall is unlikely to face any significant improvements going forward. What does that mean, especially for disadvantaged communities?
Look, Cathy, I think these are really difficult questions. The stark reality is that healthcare provision to people dependent on publicly funded healthcare has actually regressed. Primary healthcare availability is a real challenge. Like the minister correctly noted, we can't look at the health budget in isolation. We also have to look at the 9 provincial health budgets, which are funded through the provincial equitable share and doesn't necessarily feature in the health budget vote. But all of those budgets for this year are okay. But once you start stripping out the additional allocations for COVID, and I think Treasury's done well to try and maintain the budget, but maintenance is not enough. Over the next 3 years, we see even those provincial budgets beginning to shrink. What that means is that we won't be able to employ new staff. In some instances, I saw declines in the HIV, or now what's called the District Health Services grant, decline over the next 2 to 3 years. And those grants pay for medicines. And, we've got a massive TB epidemic, we've got a massive HIV epidemic, but it is abating. 5 million people on treatment, but it's still well short of the 90% we need to get there. So without any serious prioritization within those programs, we're not going to be able to meet our targets or even to sustain healthcare services at the level that they were in 2019, which was already bad.
The interesting thing for me is that the health department has for a number of years spoken about the need to strengthen primary health care and ensure that that space within the sector is solid enough as a foundation to build on for the introduction of the national health insurance. Now, with these declining budgets and the ability then to do exactly that, it very much sounds to me that the future of the NHI is now in jeopardy.
For me, I think the future of the NHI is like there's no other alternative. And maybe we should look at the NHI in terms of how it's, one of its major priorities within the transitional period until the full implementation is the strengthening of publicly funded healthcare services. And it does that by really changing the way that budgets are allocated. Now, instead of having provinces having to go through these difficult decisions in terms of allocating where, and invariably what happens is that like large hospitals and large big metros seem to absorb all the budget. Under the NHI transitional measures, they create an opportunity to fund like district systems more directly and allow them to develop responses relative to the populations that they serve. And I think in those areas, that's probably where we're going to be able to strengthen primary health care. We can't strengthen primary health care if we continue to control resource allocations and budgets at a provincial level with almost no autonomy at the local level for those officials and bureaucrats and activists to make the kind of adjustments that is relevant for the areas that they're in. And so I think we have some difficult decisions to make. I don't think we can afford to continue funding the health system in the way that we do. And we need to start having some real conversations around, firstly, the protection of human resources for health. Currently, government has an employment freeze on all public sector employment, and they've also got a wage freeze. And what that means, no workers are excluded, including healthcare workers. And we know that healthcare workers are highly mobile, and this places a particular risk for those healthcare workers that work in the 41 districts that are considered rural in our country.
And that also becomes a big challenge because we are, as a country, continuously struggling to retain staff because they go elsewhere in the medical sector to seek better opportunities, whether it's remuneration, better working conditions, better safety conditions in the workplace.
It's funny that you should mention that. Like on average, we produce around 1,800 new healthcare or new doctors every year. Depending on who you ask, the figure ranges from 1,800 to 2,700. We're not quite sure how many of those emigrate after community service. But of all the new doctors that we retain, or we train every year, and we fund for that from public money, we probably only absorb just over 10% of that. The rest of those doctors tend to go and work in the private sector or in areas outside of their primary focus. But if they're working in the private sector, then you also have a challenge that you have an oversupply of GPs, possibly, or underemployment of GPs in the private sector, as most of them are probably concentrated where medical scheme coverage is at the highest. So in many ways, the inequality in our country, because we're not addressing it head on, just gets replicated in every new sector as it develops. We're also beginning to see this in education with the emergence of more low-fee paying schools, and the capability of the state to actually maintain its constitutional obligations is slowly being eroded. And the bottom 80%, unfortunately, have to bear the brunt of that. And for a country like ours with years and years of segregated separation, and we're now having a different kind of economic apartheid, where the poor are sort of left on their own, and the rich, or the top 20%, even in times when times are hard, are benefiting. We know that in the last budget we gave tax rebates, we actually increased medical scheme credits, while at the same time just stopping funding to publicly funded healthcare. And I think that can't be right.